I am Pratika Katre and I welcome you all to Dialogues on Development Management 2025. DODM is India's leading conference on development management for reimagining how we build and lead social purpose organizations. The name of this session is Models of Assessing Impact Across the Spectrum of Efficacy and Cost. In this session, we'll unpack a few impact assessment models, why they are chosen in different contexts, and how organizations have used them to make effective decisions. Our speakers for today are Amit Saraogi, CEO, co-founder, Oorja Development Solutions; Sajitha Rajeev, Head of Projects at AMM Foundation; Dr. Sambit, Rath, Senior Regional Research Lead, South Asia at Women's World Banking, WWB; Parul Agarwal, Head of Outcomes Measurement at Center for Effective Governance in Indian States, CEGIS; Pratima Singh, Program Officer of Measurement, Learning and Evaluation from Gates Foundation; and Pradeep Singh, Head of Monitoring and Social Impact at HDFC Bank; and Sharon Weir, co-founder for Fourth Wheel Social Impact, who is also the knowledge partner for this session, will be moderating the panel. So welcome to all of our speakers, and handing it over to Sharon to take it forward.
And thank you for staying and actually making it for this session. Before I begin, I'd just like to check if everyone's had coffee. Did everyone get coffee? Yes? Okay, super. I think the previous session was, really took us through these big questions of attribution and contribution and intangibles and tangibles and all of that. What we're going to do now is something a bit simpler, but will allude to very, very similar concepts. Have a great set of speakers with us who represent very different kinds of organizations. So we have CSR with us, we have a philanthropy fund, a domestic philanthropy fund, we have an NGO, we have advocacy firm, we have a social enterprise, so we've tried to bring different organizations together to really answer the question of, how do they measure impact? So without much going into what we're going to do today, I'm going to do a very quick 7-8 minute, really quick orientation to different assessment methodologies. There were lots of sort of terms thrown about in terms of what is like longitudinal study or quasi-experimental, etc. What we're going to do is really take all of us through the different kinds of studies so that when we start discussing, you all would be able to relate to what the panelists will be talking about. After that, I think we will hear from each of them. We're going to be very, very quick, very, very short, and answer two very important questions as to why they chose those assessment methodologies, which I will show on the screen. And most importantly, what did they do with the results? So, we were all talking about we want to tell our story, we want to measure impact, etc. But the crux of it is making decisions, using the data that comes out of your assessment studies. After that, there are some worksheets for all of you. At the end of the session, I really hope that you can take away one idea, one solution, or one sort of action area to your organizations, and that's the idea. So there are two handouts. The first handout is about, kind of a listing of different methodologies, pros, cons, what to think about. And the second handout is like a reflection sheet. After you hear the panelists, would really like you to look at, these sort of very prescriptive, directive things of what you should do, and then ask us questions about that. All right. So let's jump into it. When we talk about assessments, right, a lot of times we think, I want to do a very detailed, rigorous study. But at the end of the day, I don't have the time, and sometimes I don't have the budget, and sometimes I don't have the people, right? So I have to navigate between having man, money, resources, or man, money, material, and, the right methodology. So there is this constant sort of, juggle between what should I do? before we get into rigor, I want all of us to have a shared understanding on what does rigor mean. And this progression shows that. So, when you're just talking to a few people, doing, case studies, etc., it's about very anecdotal evidence. You'll get some stories here and there. Then you move up and you say, okay, I want to understand, actually, let me take it from the audience. Can someone give me one example of, just in one line, what is the work you do? Anyone? So I can just take that as an example. Anyone? One example of a program that you're working on.
We are an organization named Anon Global Foundation, and we currently work upon mental health skills, leadership, and life skills, basically.
Super. For youth?
Yeah.
Okay, great. So I want to understand if my program or their program has had an impact on mental well-being, leadership, and skills, all right? So the first option is where I can go and speak to 4 or 5 youth and get their perspectives on these 3 outcomes that she mentioned, right? The next could be I could speak to a few more people, but I get different perspectives. So not just youth, their teachers, their parents, their friends. That's fine. Yeah. So you get a few people's perspective, not just your main beneficiary or not just building that case study. You then go into getting a good mix of people, more, start thinking about what kind of youth. Is it just, youth from a particular age group? Is it girls? Is it boys? So you're trying to get a bunch of people, but your sample is still relatively small. And then you go into, where your rigor increases, where you say, okay, I need to do a confidence sample. I need to get at least 300 people. I then need to do out of these, the youth that they work with, how many age groups, division, or, gender, location. You can bring a lot of different things. So you ensure that you have a mix of different perspectives. Just another example, or let me close this. And the last is a very in-depth impact analysis is what I'm going to show you in the next couple of slides. Just one thing to keep in mind when you do impact assessment studies, what you see with farmers in Gujarat would be very, very different, even though the program would be same, or in this context, youth would be very, very different from what you would see in a Chhattisgarh, right? So that's why rigor comes into play when you can for certain say that this is kind of applicable to different contexts, okay? This is kind of a life cycle of a lot of you would be doing impact studies, and you would see, there are different kinds of studies you do, baseline, endline. I think all of you would be oriented to it. But what I'm going to show you are 7 different kinds of methods, and each of the panelists in the room have dealt with one or the other, yeah? So what you would see in the next couple of slides is the intervention, the control group, and the participant group. This, I think all of you would know, is a longitudinal quasi-experimental where you're tracking, let's take youth, tracking youth over time from a baseline to a midline, and you have other youth who haven't participated. Lots of money, resources required for something like that, okay? But it has very high rigor. The other ones are quasi-experimental, where you have not over time, but you're just doing a baseline endline, which is very common that all of us engage with. And then you have your randomized control. The only difference, there's a lot, but what you need to keep in mind is that your comparative group is selected randomly. You're not saying, I take this person and this person. It's very randomly selected. You then have a truncated longitudinal, like a lot of you, we were discussing earlier also, we don't have baselines. But now is always a good time to build a baseline. You don't need to go in, you don't need to call it an evaluation study. It could be your midline, and then you track that over time. And that's your truncated longitudinal, again, looking at it over time. And then you have your pre-post with a comparative group at the end. A lot of studies we do is we have a baseline, and then they say, okay, we worked in this context. Can you now also compare women who haven't used safe hygienic menstrual pads, and you bring that in at that time. And then what is also very common is you've done the intervention, you've worked with youth, and then you just do a comparative study. And then you have, again, your baseline and line of the same participants over time. Lastly, and again, extremely common, is the one on your post-test only, which is your SROI studies or your rapid assessments, your qualitative methods, etc. So what I'm trying to say over here is there, and all the organizations and the panelists we'll have today will say that they've not used a quasi-experimental only, or they haven't used a post-test only. And no one size fits all. Lots of organizations do multiple methods. So don't try to find that quick, or that golden bullet, so to speak, because you have to mix it up. You have to see what's suited to your context, and we'll hear a lot more about that. Number two, trade-offs are inevitable. So if you do want a long-term, quasi-experimental design to be done, you will have to spend that money, right? But there you can find common ground in terms of what is the different kind, what is the method that's most suited to your organization. Adaptation, adaptability, really, really important, because you might start out with saying, I'm going to do this study over 5 years. You might, not have funding. The team who was leading it might leave. There might be a COVID context. There could be different things. So you have to kind of think on your feet and adapt as the context evolves. Most importantly, stakeholder needs. Who are you doing this study for? And, in the previous panel, we were talking about not purpose of the organization, but the purpose of your study. Who's going to use these results? Who's going to look at this? Are you making a 90-page report which is going to sit on the table and just the M&E team is going to look at it? Or just the leadership is going to look at it? Or can you distill some findings from it and take it back to your teams, take it back to your partners, and actually use the insights that came out of it? And lastly, the value, and I cannot say this enough, if you're doing evaluation, the value is in the use. How do you use that evidence to, change, improve, scale? What decision are you making with it? So with that, I think just a quick sort of precursor to evaluation methods, so that when the panelists talk about their experiences and their context, you'd be able to, kind of resonate with it. Today, we'll be looking at this. It's on the spectrum of rigor and cost. And you'd be seeing we've tried to cover all the different kinds of monitoring evaluation studies that have been done by different kinds of organizations. And with that, thank you very much for listening. With that, I'd like to invite our panelists and then have a deep dive into this conversation. Thank you so much. Let's just go this way, actually. Amit, two things, and the panelists and all of us have done a dry run, and we've promised to be brief and use examples and keep you engaged. So call us out if not. But Amit, if you could start us off in what does Oorja do? Why did you choose? Amit's going to be talking about the social return on investment, the SROI study, and how did you use evidence? Over to you, Amit.
Hello. Yeah, I think so. Yeah. Well, thanks, Sharon, for having us here. It's an honor, and yeah. I represent an organization called Oorja. It's a for-profit social enterprise. We work at the intersection of sustainable agriculture and renewable energy. So we are trying to decarbonize agriculture in India in many different ways, but by deploying assets. Our own innovation is our business model. How do we bring, because solar, while prices have been declining over time, they're still not within the reach of the smallholder farmers, and that's the target group that we've selected to serve. And therefore, we innovated and made it as a service, solar as a service. So there's irrigation as a service, milling as a service, cooling as a service, climate smart advisory, and so on and so forth. Yeah. So that's briefly what we do. SROI. So since inception, actually, we have been conducting our own longitudinal studies. We have a baseline. We were very conscious of that. And we follow it up with midline, questionnaires and surveys every year. It was informing of us of quite a few things so that we could fill the gaps in the services we were offering. But then because we are private limited, we have investors, we have a cap table and several impact investors who support us. So they were, of course, getting, understanding of the financial returns through the balance sheets and the P&Ls and all of that. But what about social return? So they wanted to understand and know how far is each dollar or each rupee invested by them going in terms of creating social, economic, and environmental impact. And that's how we arrived at the selection of the methodology, SROI. So that's the context of why. Of course, there were other considerations before we selected SROI. How long will it take? What in-house resources will be required? Of course, they were, Fourth Wheel was actually conducting this for us, but it does require us to also spend some time and resources. So all that, what is the trade-off between, cost? It was supported by one of our investors, so that was not a concern, but also other resources required. So once we knew that will work well for us, it's a good fit methodology and will give us the outcomes that we are looking for. Now coming to the outcomes, so we all know that impact deepens over time. You're not going to see impact immediately, and depending on the sector you are in. And so what it showed us is where to lean in and where to evolve. And so they were short-term. We could understand from the outcomes the short-term gains we are making and the longer-term gains. So to give you an example, the study was, just to give a little bit on the study itself, the sample size was about 333 farmers across 3 districts, divided into treatment group of 222 and a comparison, a control group of 111. So what it allowed us to do is understand where we have been in operation for a shorter period of time, let's say 1 to 3 years. We were seeing different impact, like savings on the irrigation cost compared to what they were using before. But in districts where we have been operating longer, 6 to 8 years, let's say, the gains were much longer term, like growth in income, reduction in drudgery, or diversification of their cropping cycles, much higher yields, and so on and so forth. So that is a very informative. So then we know how long do you need to stay or how many seasons do you need to continue before you can actually create that level of bold impact, right? So that's one thing. Then the second thing it allowed us to do is also re-strategize, refine our strategy. To give you an example of that, so because we are private limited, we sell our services, there's a certain tariff. We thought, one size fits all, and we should standardize everything that we do, standardize our tariffs, standardize our workflows, standardize how we do things in different districts. But of course, we found out that's not true, and we might want to, customize it for different districts, and this brought that out. So there was a perception. So when we price our services, we price them cheaper than any alternative. So we thought this may be conveyed very clearly to all the farmers. But through the study, we found out about only 40% of our beneficiaries knew that actually what they are spending is cheaper than anything, any other alternative they had. So then we're like, what's going wrong over here, right? So then we looked at our tariff setting and how can we optimize that. So in districts where, and then that led to a win-win for all of us because they were getting the service even more cheaper and more affordable for them, while our revenue started growing despite reducing those tariffs and optimizing those tariffs. So I don't know how much time I have, that's why I'll stop because I can continue.
No, but thank you, Amit. And we'll go to Sambit, but just want to summarize one thing. And a big learning for us also when we did the study was the tariff piece, right? It was really good to have leadership, program teams, everyone come together and say, just 40% know about this. And that's how it was used to actually then redesign, co-design, and move forward with it. But that's it, and over to you, Dr. Sambit.
Thank you, Sharon, for having me here. So, Women's World Banking, right? So, we have been around for the last 40 years, a global not-for-profit. So, what we do is we are committed to serving about 1 billion women who are excluded from the formal financial system. So, that being the overall objective. How we operate is through a two-pronged approach, and that actually is important to know how we approach this whole how we decide on the methods, etc. So we have, our major work is advisory focus. So what we do is we partner with FSPs and, through bringing in women-centered design to financial solutions. And the second prong is that we have an asset management arm. So basically we invest into different, again, FSPs and to, take forward that agenda. Now, so because we have this dual, way of operating, we have a unique way of looking at evidence. So the way we look at is because we are working with large public sector banks, NBFCs, and even with regulatories. We are when we look at evidence, we are looking at evidence through a 3-tier sort of a system. We are looking at micro, which is the women that we serve; meso at the institutional level, that that there are outcomes, there are metrics that are relevant for the FSPs that we serve, and also the macro, because when we move the needle, for a public sector bank, it is actually reaching out to a really large swath of people. So that means there is impact to be accounted for at that level also. Now, what this approach does is that it is like like we heard a realist evaluation earlier. Similarly, what we do is we approach it through whatever means that we can to tease out the impact. So therefore, we take a look at the administrative data quite a bit. We leverage the gold standard RCTs and all wherever it is possible. But we also try to ensure that whatever lessons we learn from the pilots are robust also. So for that, there is a time element to it. I cannot wait for 6 months to tell the advisory that, okay, this program is working. So therefore, our methods necessarily have to be nimble, agile, depending on the context. And so therefore, we have done all the various things that Sharon was showing earlier. What I would like to, focus on are 2 case studies. So one is one of the first projects that we did in India, actually. And this is, you would all be knowing about Jan Dhan. So Jan Dhan Plus is basically our program riding on that, where we saw that women, are a lot of accounts were opened, but engagement with those accounts were not as much. Now, how did we go about it? Is that we partnered with Bank of Baroda. We started with looking at the administrative data and tried to understand, where the drop-offs are happening actually, right? So, are all the women, engaging the same way? Who are the women, who keep on where the engagement level doesn't, drop? So, and then from that analysis, we identified that if we intervene at the beginning and then ensure that there is a, that we get them to engage, say in the first 5 months with depositing a certain small amount, and then incentivize them by giving them an OD or a something that they can take if they save, say, consecutively for 5 months, for example, then this is something that can work. So the next step was that we piloted it, and then we piloted it in urban, in a semi-urban and a rural context, and then that was an RCT, and then it was a quick and done cluster RCT actually, where we proved that it not only brings in engagement by ensuring that the frequency of savings go up, the number of women who comply to the intervention design that goes up, but also there were other women economic empowerment related indicators which are also sticky. So some of those things are lasting. Now what that allowed us to do is that it brought in that credibility whenever we went to another bank. It allowed us to engage with them. So right now we worked with UBI, we worked with Indian Bank, then we are currently working with around 21 regional rural banks. So we could take this solution to them, and the evidence provided us with the ballast to take it forward. I would like to bring in another example. So this is a credit guarantee scheme that we are working with. Now by construct, a credit guarantee scheme is a national scheme, for example. So therefore you cannot have a counterfactual there. But does that mean that we cannot find out impact or cannot find out attribution there. So what we did is we, again, used administrative data in a very creative way. So there is a method by which you can look at bunchings across credit guarantee thresholds, and using that you can recover the elasticities, which are causal in nature. So therefore, basically, what we were able to prove that when we moved the needle by getting the credit guarantee fund to increase its guarantee coverage for women, that led to FSPs being the member lending institutions being more responsive and more credit flowing to this category, which would not have otherwise flown. So we could give it a numeric metric. And so this second example is what I would say an example of a meso or a macro sort of an impact. And in between, we also, there is another thing that distinguishes us in terms of the way we approach evidence is, for us, we have a lot of pilots that we do. So therefore, for those pilots also, the evaluation has to be done. And not all of them can be done like using all the methods that we saw. But what we try to do is what I would like to say, a constant maximization kind of a thing. Right? So we always will work with constraints, but what is the best that we can do? What is the best rigor that we can recover? Sometimes recognizing that rigor is not the be-all and end-all. So sometimes it is important to give the result in a timely manner, and sometimes a case study can also do the job. So to come back to sum it up, we look at a three-tier way of approaching evidence gathering, use case both internal and external, and thirdly, methodological, what we say, like multiple methods at the same time. Thank you.
Now, Pradeep, if you would like to come in, Pradeep's going to be speaking. He's from HDFC Bank. He's going to be speaking about standardizing measurement systems across different partners. And I know there's lots of aversion to that, but I would love Pradeep to explain why that's also super important. Over to you, Pradeep.
Thank you, Sharon, and really glad to be a part of this gathering and this panel. I am representing HDFC Bank CSR, which is one of the largest CSRs in India. In fact, as per the recent communication today morning only, we are the largest in this financial year. We have 1,300 plus crores of budget which is to be spent in this financial year across India. We are investing this amount in 300 plus projects, and with the help of 150 plus partners, we are implementing these projects across India. My team is called MI team, Monitoring and Impact team within the CSR team, which is responsible of project monitoring of all these projects, as well as different types of assessments, what we do for these projects. We do needs assessment, first of all, right, to understand what all are the needs of the target communities, on the basis of which we design our programs. Then we do the baseline studies to understand the current status of our target beneficiaries. Then we do the midterm assessments, and then we do mandatory impact assessment studies for us. Just to give you an idea and the visibility on the kind of scale at which we are working, because that is directly linked to the challenges and the kind of research method we are trying to deploy. In impact assessment studies only this year, we have 161 projects across India for which the assessment is to be done. The similar numbers are there in needs assessment studies and in baseline studies, and some numbers are there in midterm as well. So overall, we have 500 plus projects in this financial year which are to be assessed using different methods. So my team basically works on all of them. So as far as the monitoring of our work is concerned, we do this using 2 online tools. And in the assessment part, we have 15 plus research partners who are doing this work for us. They are going on the ground, they are collecting the data from very difficult terrains, and then they are analyzing and giving us the report. One of the major challenges is obviously doing this work all together, by 15 plus research agencies and conducting timely these assessments, because mandatory impact assessment is a compliance part from the CSR rule. But that is still manageable because we have partners on that. So 15 plus partners are going to the ground and doing this work for us. But the major challenge is actually emerges after they are giving us the findings and the reports from the ground. Because if I only talk about impact assessment reports, every quarter I'm receiving around 40 reports at my desk, which I need to review, I need to make sense out of it, and I need to present it to the leadership and to other stakeholders. That is the most difficult part, because these 40 projects were, first of all, implemented by different implementing partners across India, where within the same type of program, there are different approaches of implementation. Then these are evaluated by research partners in their own ways. They have their own tools, their own methods of data collection, their own sampling methods, their own data analysis tools and the methods again. And then the report structure. So somebody is giving me report in 50 pages, somebody is giving me 200 pages. So that becomes the most challenging task for my team. So what we do in this whole process to tackle this challenge is we are standardizing the entire process. It is starting from the tool development to sampling to data collection, how the data is to be collected, how the questions are to be asked, then about how the data is to be analyzed. Because if you have the same set of data and you are applying different calculation methods, then obviously the impact is going to be differently seen. So the same type of, not same, exactly the same methods are to be utilized to analyze the data, and then the right kind of data visualization using certain, again, technological tools are to be adopted. So this is what our current focus is. As far as different research methods are concerned, these research methods are very, very important. And we need to understand them, and we need to see the application of these methods. But for a large organization like HDFC Bank, if you are also one of those organizations, for you, it is, for me, I am not just trying to experiment currently with different research methods, but maybe I'm trying to create a tailored approach using different research methods, taking good from different methods, and then applying the same method onto all my 300 plus projects, so that I can ultimately achieve cross-project, cross-partners and cross-region the findings. So that is what our current focus is. Thank you.
Sure. Sure, thank you. I'm Pratima Singh. I work with the Gates Foundation. Some of you might be aware that the foundation essentially is one of the largest personal philanthropies in the world. By the end of my organization's work 20 years hence, we would have spent about $200 billion working across the globe on issues of development. In India, we work on issues ranging from public health to women's economic empowerment, agriculture, I could go on and on. As you can imagine, given the scope of the work that we do and the level of responsibility of being stakeholders in this massive resource environment, we have big responsibility of two kinds, especially as the measurement, learning, and evaluation team. One is to fulfill the accountability function, right? That is to say, how we were talking in the previous session about what is the account. So year on year, what is the difference that you're making in your impact goals of pushing them further along towards your agenda of, say, bettering NMR rates in India, for example. And that's something we track annually. And a lot of this is done through either administrative data or through national level surveys, or frankly, a lot through monitoring data that we get from our very large network of trusted implementing partners. And so that's why the last session was super interesting to me to really hear firsthand how these partners look at their long-term impact and how they think about it. The second function that we provide is we call ourselves a strategic philanthropy, which means that year on year we look at how we can maximize the good that we can do from every single dollar that's invested. And the way that we do that is through the process of adaptive management and learning. So that learning function is kind of the second thing that we do. And to really truly accomplish that, I would say we work across the spectrum that you mentioned, Sharon, of the different types of evaluations. But often really what it comes down to is, what is the decision that we want to make using the results of an impact evaluation or a learning engagement of any sort? What are the constraints? And the constraint for us often is time. Like you also mentioned, we're not often looking at timelines that you can give an RCT 3 years to complete and then say, oh, I'll make a decision when the results come in. The results often come well after the fact that you've made the decision, or the government's already decided to scale up a program you're supporting. So oftentimes we do more strategic, more nimble evaluations. We have also recently done a big realist evaluation of our, what we call a portfolio of work, which is to say, It's different from, doing investment levels, impact evaluations, but that's also not tenable for us. We're at 600 investments, like you mentioned. It's just the scale really makes it important for us to be able to aggregate at the level of effort. So what we did recently, and I'll jump right into the example of how we use the evidence from this. So Population Council recently did a realist evaluation of our work, where we're supporting a state in building technical capacity, or providing rather technical assistance for a state to improve the health system's strengths in delivering public service, right? Public health delivery. And we make a lot of assumptions when we set up these programs, right? We say, okay, if we give the state digital infrastructure, obviously health outcomes will improve. If we give the state, support in improving supply chains for medication, for diagnostics, obviously, the impact goals will be reached. But when we make these assumptions, what we're missing is really, very crucially, and something we cover deeply in realist evaluations, is the context in which you're working, the mechanism through which this change is supposed to happen, and therefore, the final outcome that you're aiming at. So what we learned, to give you an example concretely, so we said, okay, we're investing in, say, various different health apps, right? The apps will be used by what we call frontline workers, like your ashas or Anganwadi workers. So they should be able to use said apps, unnamed apps, and they should be able to input health data for the geographies in which they're working, which can then be aggregated at the block, district, state level. And this should really streamline decision making on the basis of what's needed in a particular geography. It should also help them in their own work because they can keep track, things like that. And while these were our very noble intentions and these were the assumptions, what we realized from the realist evaluation as we went into the field is that some of the key assumptions that we were making, like a frontline worker is able, first has access to a device which can be regularly charged, which they know how to use really well and navigate, and which they'll be able to use in the field as they are doing their work. So all of these really big assumptions, right? And we realized that we were not meeting a lot of them. So what they were actually ending up doing is to still use the old way of using manual registers. But what we had done effectively was double their work of going home, putting that data into an app, which then likely increases the level of error in the data. And then that data going through the process of other stakeholders who were also not equally comfortable with using such apps, or at certain levels didn't even have salience of the fact that these exist or these are to be used in what way and how. So I think a lot of these assumptions break down as you go deep into the context. And as you question whether the mechanisms that you assumed are going to be taking place are actually happening. And therefore you're able to say, okay, this is why I'm not reaching my outcome. Right? Not just through an impact evaluation, whether it works or it doesn't work, but it really gives you concrete next steps for, okay, if you really want this to happen, you need to take a step back and you need to say, this is where I will work. So that's kind of the adaptive learning framework that we're trying to really internalize and say we need to keep doing this repeatedly to reach where we want to in terms of impact goals. I'll stop here.
Maybe just to bring some context, Sajitha works with AMM Foundation, and she's going to be talking a lot about low-touch MEL studies, right? So very adaptive management and probably on the same lines, but over to you, Sajitha.
Thank you, Sharon. So before I go into what the impact assessment methodology that we use, I would also like to say a few words about our organization. AMM Foundation is the philanthropic arm of the Murugappa Group. It's an 100-year-old organization which started in 1924 with one hospital. The project was started before the organization. The organization was actually formalized in 1953. So, that's the commitment the organization has for the cause as such. We work in the sector of health, education, environment, and sports. See, for us, the impact assessment is actually weaved into the way we conceptualize the project and we implement itself. Because, given the history, for us, we have to keep reinventing the way we look at the issues, how we handle issues, the problems, what kind of solutions we want to, bring on the table and all that. Because what was in 1924 and what is in 2024 and 25 is very different. And, the need is different. During that period, the requirement was establishing institutions So we went around building schools, went around building hospitals, mostly in Tamil Nadu and southern part of India. And in 2011 we started, we really looked at, are we on the right path? So then we said, okay, fine, let us pause on building institutions. Let us also look at less capital intensive projects which would reach into rural India. So there starts another chapter in the foundation where we started doing a smaller, if you can call it as smaller projects in terms of the capital as such. So that is when we really, Pradeep had shared, the needs assessment forms the base for our impact assessment also. Because the results of the needs assessment actually translate into the concept of the project and the objectives that is fixed. The monitoring and evaluation process, the stakeholder engagement, every stakeholder is actually part of our impact. So there is constant review, constant engagement, constant feedback that gets weaved back into the objective of the project itself. So when we start a project A, we would have decided on a very broad objective as such. But as we go along and as we get the feedback from the stakeholders, feedback from our monitoring sessions, we also tweak the objectives. I would like to straight away go to an example. We have been running a football academy. It's called as Murugappa Youth Football Academy, which we started in 2015. The academy was basically started in one of our schools, which caters to the lower income group of children. And these are from, the coastal side. So a lot of fishermen children were there, and, the issues of the fishermen community was also coming into the school. Lot of infighting in the community was getting into the school. Very high energy, tough kids coming in. So you put up a new restroom, 1 week after that, the commode is broken. So that was the kind of issues we were facing. So that is when we got back and we started thinking on what shall we do. Sports, and particularly football, we zeroed in on football to bring about a behavioral change. So our football academy was not intended to produce football players for India. It was basically to bring our boys and girls back to school, bring about behavior change, give them a purpose in life, and also to engage with the parents. That was the objective of the football academy. We started with 100 boys in one of our schools. And when we said this was our objective, we also decided let us give them a proper football coaching. That was the secondary objective. To give them grassroots level professional football coaching was the secondary objective. So as we went on 4 years, we were continuously monitoring on how the boys, it's a boys only academy even today. So the constant engagement with the coaches, with the teachers, particularly the PT department of the school, which engages, which is given the responsibility of monitoring discipline in the school, their academic performance, and also the parents. So we like the schools have their parents meeting quarterly. We also have a parents meeting for the football academy quarterly, and full house turns up for the academy. It's a morning session, the coaching as such. So we realized it was showing an impact. There was a huge behavioral change. All these 100 boys were, reports were coming that their behavioral issues are settling down. Use of cuss words have reduced, infighting has reduced, academic performance mainly has improved. We started recruiting boys from 6th standard, and once, after 4 years, till today, it's been 10 years. August 2015 we launched, this August is 10 years. We have not had one failures in 10th and 12th for our football academy. And we realized that, giving this was actually showing good impact. So what the result encouraged us to, move on to the other schools also. So we have started we have 4 grounds now, 1 in rural Tamil Nadu, 3 in Chennai city. The way we monitored was coaches were one group. We also have what is called as, MIFA coordination committee, where you have a parent, where you have the coaches and also the teacher and the PT department teacher of the school, so that the feedback system is there. Because every day, whenever there is an issue or something, what happens in school, the committee is also involved. So this is one major, tool for us to actually measure the impact of the academy as such. But, last 4 years has really turned us, because we just casually, when we were engaging with the boys on how they are doing and all that, few of the boys said, we have been playing football in the ground. We've been doing well in studies also, but we don't get to play matches. What do we do with this football now? And our coaches also kept saying this, we should play matches, we should play matches. So then we slightly tweaked our objective and said, okay, even then we said we will not go in for competitive football. We will play practice matches, we can have tournaments, let them go around and they'll play for zonal schools and all that. But we said, as of now, we will not get into competitive football. So they were playing and all that. But in one of those exposure was, we took our boys to Salgonkar FC in Goa. That, what happened there really turned us again, because we realized that these boys really have talent. So, while going, I also had traveled with them. So I told the boys, please don't lose. Even if you lose, don't lose with 10, 15 goals. 4, 5 goals is fine for us. So, but they won actually against
Sure.
Salgonkar. It was
I
a
think,
shock for us,
Sajitha,
yeah.
I think what is very interesting is, thank you for that. I'm sorry, I need to move to Parul, but I think
Just one small
sure.
point I'll add. So
Sure.
we, and now today with all these experiences, we have been accredited by All India Football Federation. We have gone into the competitive football also. Our boys will be playing National Youth League this year. What I want to say is, it is not a stagnant objective, it is not a stagnant impact. It is a journey, and the constant feedbacks actually helps us to move forward and also change the objective as per the needs of the community. Thank you.
Yes, I think two very big points here with low-cost meal studies, and thank you so much for that, Sajitha. One is, you can do low-cost MEL by ensuring feedback loops are built into your system, and you're regularly engaging with different kinds of stakeholders. When you think of the rigor of that spectrum that I was showing, this is a great example of having it. I remember first talking to Sajitha, and she's saying it's built into my, DNA, into our organization DNA, which is just part of our job. So I think that's one very interesting. And I think the second part is that, impact evolves over time, like what Amit was saying, like what Sambit was saying, like every time you look at your data, there has to be something that it's telling you and that you do something more about it. And that's the crux of impact. It's not about, creating that. And I think a lot of this panel are donors. So, there's a lot of kind of flack that we talk about that, donors want short term, donors want quick. I think that's kind of a myth, and I'll let them respond, and I would love to hear from you all. But I think what they are saying is about it being adaptive. It's about using evidence, regularly checking on that. And that's a huge point to take away from this panel. I'll wait for the questions. But over to you, Parul.
Thanks, Sharon. I think a lot of my principles already got covered here. But so I work with Center for Effective Governance of Indian States, and we work on strengthening state capacity to achieve human development outcomes at scale in a cost-effective manner. And to do so, we co-create solutions with the state government. But we ensure that these solutions are backed by evidence and are informed by extensive diagnostics that we do on the ground. So somebody spoke about the needs assessment, so something similar, and what works, what doesn't work. Now, given the long-term nature of our work, right, like the journey from a diagnostic to achieving human development outcomes is very, very long, which means that our MEL strategy also needs to be longer term. It needs to be embedded, adaptable, and be consistent, right? We cannot just drop the ball at any point in time. So we have identified 4 principles that are very important to us, and these are not like standardized, coming from one standardized framework, but from multiple experiences and also extensive research that is out there. So one of them is that our data needs to be credible, actionable, responsible, and transportable, so like the CART principles. And we try to make sure that we do this by embracing technology, by leveraging a lot of programmatic data that may already exist. The second core principle is that a lot of scientific data, scientific evidence already exists, but it is not sufficiently leveraged for designing of solutions. It is not sufficiently leveraged to define the theory of change around solutions, but it is possible. So that is our second principle. The third is that we acknowledge that system strengthening is just a part of the whole, right? Like only system strengthening cannot lead to outcomes, like especially the ones we are targeting, human development outcomes. We are part of a bigger winning coalition, right? Like, so it's a contribution that we are making and not necessarily, we cannot attribute the success to CEGIS's work. And the fourth key principle is when we are talking about systems change, systems is essentially people, right? So it's very important, like systems change is basically how behaviors change of these functionaries and officials over time. So it's very important to measure behavioral change systematically. So following these four principles, like we have, when we develop MEL strategy for any project, we do it, one is internal within CEGIS and second is with the government as well. Because CEGIS will move out at some point, but government should have the methods to be able to systematically track what is happening, what is the performance of the schemes and programs, etc. So for the internal, so I'll take up both of them one by one. So for the CEGIS's internal MEL strategy, we measure outcomes at two levels, the system level and the citizen level. The system level is where a system includes functionaries as well, and that is where we are more confident about establishing attributability, but not using RCTs necessarily, right? So we do a lot of process tracing, a lot of outcome mapping to understand behavioral change, to measure outcomes like improvement in data quality or reduction in delays in service delivery, or measuring the journey of functionaries from knowledge to change in attitudes to change in practices, right? So a lot of those qualitative methods come handy. Then at the citizen level, we try to build a contribution story or a contribution narrative, right? Where we try to, because we kind of work like a assembly line, right? Like an outcome, what might be an output or outcome for CEGIS may be an input for another organization, right? Like, so if we are trying to improve the quality of learning outcomes data, then that data can be used by, let's say, teaching at the right level interventions to improve eventually the learning outcomes. So we try to understand this chain of events and, build a contribution narrative around it. We haven't really done it as yet, completely end-to-end anywhere, again, due to the long-term nature, and CEGIS is just 6 years old now. But we are getting there, and this methodology has also evolved over time. And what it helps us do is to build a case. One is socialize the idea that systems change can be measured and can be measured using these adaptable methods. It helps us build a business case for replication, for scale, both with the governments, because governments always need a precedence, right? Like, has it happened before? Why do you think it will happen? And then also with the donors, right? Like, what is the narrative? Where are you heading with impact, etc.? And it becomes complex when you're working with only systems. Now, at the state level, what we try to do with governments is come up with mechanisms of concurrent evaluation systems, right? We try and see how feedback loops can be generated within the government by gathering citizen feedback. And once these systems are established and stable, like government is liking those kind of inputs, right, coming directly from citizens. So we try to establish those concurrent evaluation systems so that they sustain, and government itself has a view on what is happening with outcomes. Do I have time for an example, or shall we
Yes,
move on?
you do.
Okay.
You can finish with an example.
Sure. So I'll take an example similar to what Pratima was talking about, right? So we are working with WCD department across states to improve the nutrition outcomes for kids. And our extensive scientific diagnostic on the ground told us that there is a huge underreporting of malnutrition, like by 10x, right? And what this means is nutrition is not reaching the right kids on time, so their nutrition outcomes remain poor and they worsen over time, and we see that in NFHS reports, etc. Again, our diagnostic told us that it's not just an issue of intention, that I'm intentionally misreporting, but the issue is of capacity. They are not, like Anganwadi workers have been trained like once in 2 years, or the devices are broken, or devices are not calibrated, they don't know how to calibrate them, etc. So we try to build a solution, and we call it supportive supervision, where the idea was to use a lot of data reported by Anganwadi workers to identify some of these issues and do a lot of complex back-end data analytics to guide supervisors as to which center to visit, when to visit, and what to do when you visit, right? So it's not just an audit, but it is supportive supervision, so to say. Our initial idea was to audit, honestly, right? To see what the real assessment of malnutrition was. But over time, what we realized was that supervisors themselves started supporting Anganwadi workers to report better. Okay, you are not able to read the scale properly. Can you do it this way, that way? The other thing that we started seeing was the quality of time supervisors were spending at Anganwadi centers increased substantially. Earlier, it would be like touch and go, 5 minutes, 10 minutes, but now they were spending like 135 minutes, which is like, you know, around 2 hours during a single visit. And then they themselves started doing small trainings, micro trainings at the center, referring them to the material and all, because they also know that the training, official training schedule will happen in 1 year, right? So those kind of insights, and they started helping us refine the intervention. So our monitoring mechanisms were such that, you know, they were set up to troubleshoot. But the feedback we were receiving from them showed that they were owning the process, right? And they started refining the solutions themselves. And now we are at a point where they are trying to analyze the data themselves, right? So they are saying, okay, an Anganwadi center cannot have 0 malnourished kids, so I'll just pick those and go there and see what's actually happening, right? So a lot of this behavioral change is also something we are observing. I'll just pause.
Amazing. Thank you so much. So I think just to kind of summarize, and you know, we've looked at the SROI, we've looked at comparative studies, we've looked at realist evaluation, you know, standardized methods, low-touch monitoring evaluation studies, again, looking at adaptability, having feedback loops, keeping sort of the eye on the ball at all times. And that kind of, I want to stitch it all together to say that, you know, it isn't an either or in terms of efficiency and cost. It depends on context. And that's what sort of I would like to summarize with. But over to you. Any questions, any thoughts, anything you agree with to our speakers here? Happy to hear from you all. Any questions? Anything that sprung up? Anything new you learned? Anything you want to comment on? Yes, please.
Thank you. Such a rich discussion. My name is Abhishek. I work with Population Council Consulting based in New Delhi, India. We often get lost in the debate of, you know, attribution, contribution. I think, I mean, all of us had some moral responsibility to go beyond that. And I truly believe, I mean, over my 18 years of work in this space with communities, that sometimes, like, you know, what RCT can tell, sometimes some anecdotal evidence, some case studies, some impact narratives has, you know, almost similar power to tell. We often ignore that, and being a statistician myself, I found that's, like, you know, quite insightful, those qualitative insights, and that's why Pratima was saying this, you know, realist evaluation kind of approach, which is similar to outcome harvesting, or what Parul you said, appreciative inquiry. Monitoring and evaluation should not be treated as a kind of you are policing on someone's work, but if your intent is to support and supervise for the betterment, I think it serves the holistic purpose of evaluation. And I was amazed, like, you know, the HDFC foundations, like, you know, the volume of work, and I was just thinking how this evaluation findings are getting utilized, because unless you have, as you have this feedback loop mechanism continuously concurrently checking, and if you are not analyzing this, so 130 plus or something you said programs, and you are getting every month, like, you know, 40 plus reports, and those are not discussed, you know, something is taken from there, then it's kind of meaningless. So what kind of mechanism do you guys have internally to ensure those evidence are kind of utilized internally as well as externally? Thanks.
Yeah, sure. So first of all, we have to standardize, right? Because the kind of scale we are working at. When we are talking about the standardization, we have to find a framework which is agnostic to focus areas, to interventions, to different kind of work basically we are doing on the ground. Once you are able to do that, So we are using, so I'm not going to talk a lot about it because we are still in the process of creating this whole framework. But we are also relying upon OECD DSE frameworks. We are calling it OECD Plus. So for example, we have the relevance as a indicator. Whether this program is about teaching the trainers, teaching the trainers or the teachers basically, or it is about providing infrastructure to the school. What is the relevance of that particular intervention, whether this is in this particular region or that particular region, implemented by this partner or that partner, what's the relevance? So overall, from project level to at overall organization level, I should be able to understand my relevance, right? Similarly, there are different other parameters you need to understand. So in the impact assessment, you don't need to only understand whether your impact is there or not there. You also need to know if the impact is not there, why it is not there. Right? You have to start from maybe the needs assessment, whether you had done that or not. So whether the program which you implemented was in line with the needs of the communities or not, right? So relevance of your work, the efficiency in which, by which you implemented the program, effectiveness, sustainability, convergence, many different parameters are there. Once you are able to do that, then you can evaluate all your projects on this set framework. When it is about the learning from this, first of all, again, collating this whole data from 300 plus projects uh, is again a big challenge, right? So we are using technology. I'm also a technical person, so I could do that. I think we are kind of creating this automated process in which we are collecting the data on set tools which are being used by all our research partners. Then this data is going to the backend server where we are using ETL method, extracting, transforming, and loading the data. And then from there, we are connecting it to some data visualization tool. So in our set structure, first of all the data is collated and the findings are recorded. Then it is about learning from this and giving it to different stakeholders. So majorly we have four or five stakeholders in our process. We have first of all the NGO partners who are there on the ground. We need to create some mechanism to learn basically from this process for them. Then we have the project managers so that they can learn from this. They can see whether the relevance was good enough or not, whether the sustainability point of view that was good or not. And then accordingly looking at different interventions, different parameters, and then look at their program designs for the upcoming cycle of their projects. Then for my leadership, then for investor, then for many other different stakeholders. But the idea is first of all to create a kind of framework which is which is I mean by which this is possible to have this many number of projects together and create a finding which can be then distributed basically to different stakeholders. I think, yeah.
So they do a lot of skilling programs as part of Project Parivartan, and one of the studies that we had done together, remember when we found a location of one of the skilling centers was really far, which was bringing down, the impact of the program because youth had to spend so much more to travel to these areas. So, I think HDFC is definitely, from all the studies we've done, they do look at that in a very comparative model. And that's why they are now in that journey to try and standardize it so it doesn't become more work. It kind of streamlines that, entire process. And just one more example, another very huge power company. So they've also tried to now look at community engagement, which is again a standardized approach, which is now on a dashboard. So, they are capacitating different teams across so that it's just easy and streamlined and you don't need to kind of look at those 100 reports because that's very difficult to do. But thank you so much. Any other questions for any of the panelists? Yes.
I'm just curious, in terms of, do you have a budget to do evaluation? In the last session we talked, the long-term impact seemed to be done by the non-profits themselves. Now suddenly here it's being done by you guys, so just help me understand that.
Is it directed at someone or can Pratima answer? Yes, Pratima, go for it.
I'll answer. One of my grantees is sitting here looking very amused. So I would say the budget depends, of course, on the objective and the timeline and we talked about a spectrum, right? Are we looking at talking to 5 stakeholders to gain some sort of understanding of what happened? Or are we doing an RCT which has to be representative at, say, the state or national level? So naturally, it's a sliding scale of the resources that can be attributed to one of these things. Gates Foundation usually, so it has to be very fit for purpose what you're doing, why you're doing it, what is the decision that's pending on it. And I think on the scale of the decision, is it a go, no go? Does this, what are we going to see here from this? Probably a larger resourced impact evaluation, right? If the decision is to say, okay, we know this is going to be scaled up, there are lots of strategic reasons to do it, there are obvious gains from it. We want to understand a little bit more about how we can get slightly more marginal efficiency from 3 different activities. That's probably going to be a more subjective stakeholder interview type of thing, which will be resourced much more efficiently. So yeah, the budgets is a budget.
I'm sure we'll have a budget.
Sure.
The reflection sheet, right? So data types and analysis styles. I think, I mean, I've been working in this field for around 7 years now, and I think in the last 3 years, 3 to 4 years, I would say the feeling is that we've started talking a lot, right? And essentially, so many conversations today has been about people and passion and why we're doing work. The change and social justice is at the base of it, and that's what brings so many of us in, right? Now the terms, and they're so social scientific, like scientific first, data styles, what is validated, what is not. How are we equipping organizations, especially grassroots organizations? Not everyone manages, जो काम करते हैं इस sector में, हर कोई ISDM is a very esteemed institution. We don't come from places like this. So then how are we expecting organizations to be equipped with this information, knowledge, application, proposaling, budgeting, and even making it part of the work? Because at the end of the day, someone is feeling like, अरे यहाँ पे water, harvesting करना है तो चलो कुछ करते हैं, we'll get something. So much around it. I wouldn't say a disconnect, but I do feel a disconnect. And there's so much stress on it. So I don't know where the question is in this, but it is that I feel there's a